name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn all about apraxia of speech and how you can support someone who has this condition. In order to begin speech therapy for apraxia, a diagnosis and evaluation must take place first. You should look for a speech-language pathologist, also known as a speech therapist, who has experience treating apraxia. One of the most important things a speech therapist will do before beginning therapy is to create an individualized treatment plan. The speech therapist will assess the types of sound errors they hear and whether they occur at the single word level or in connected speech. Understanding the type and severity of errors present helps the speech therapist determine what kind of goals to set. Goals are specific to each person, and they're designed to be measurable so that the speech therapist can track the client's progress. Here's an example of a therapy goal for someone with apraxia of speech. The client will produce multisyllabic words with 80% accuracy, given moderate multimodal cues, in order to improve speech production to a more intelligible level. Each session, the therapist will record the percentage of how accurate the client's speech productions are, as well as what type of cueing and help the person needs. People with apraxia often need a lot of help learning to produce new words. This cueing can be done in a variety of ways. It may include things like visually showing the client how to produce each sound with the mouth. A therapist may use visual cue cards, or they may say words at the same time as the client to help them even more. Tactile cues can also be helpful. These can be prompts like touching the lips to remind the client to close their lips for the sound. The therapist may also have the client listen to sound production and determine if it was correct or incorrect. Over time, the person will hopefully need less help from the speech therapist and will become more independent with their speech productions. The speech therapist will constantly monitor their client's progress in order to determine when to dial back on the help they're giving. Speech therapy for apraxia is all about learning new motor patterns and improving speech motor coordination. Because of this, clients need frequent and consistent therapy in order to learn how to move their mouth muscles purposefully. That's why the frequency of speech therapy sessions for apraxia is so important. For children, having at least 3 sessions a week is recommended in order to make appropriate progress. Adults are also encouraged to attend therapy at least 3 times a week if possible. Research supports more frequent, shorter sessions of therapy. 3 sessions of 30 minutes or less are effective. Some speech-language pathologists recommend 5 sessions per week at 15 minutes each. It's important to note that just as individual symptoms vary, so does progress. What works for one person with apraxia may not work for another, and each person progresses at their own pace. Some people with apraxia may need to find alternative ways to communicate and express their thoughts. These methods can include sign language, using a notebook with pictures or written words, or using an alternative or augmentative communication device, also known as an AAC device, such as a communication board or a portable tablet that writes and produces speech. In these cases, treatment focuses on helping the client learn to communicate using these systems. Although we typically think of communication as being verbal, it can come in many forms. And for someone who can't communicate well with speech, these communication forms can open up a whole new world of possibilities. Keep in mind, too, that these assistive tools may not need to be used long-term. However, using these tools while working with a speech therapist can help promote speech production and verbal skills while also decreasing feelings of frustration. Communication success breeds more success, and that's often highly motivating for people with apraxia. So to wrap up, let's review what we've covered about speech therapy for apraxia. A speech therapist will create an individualized treatment plan based on the person's speech evaluation. The therapist will use measurable goals to assess the person's progress. There are many different ways a therapist can provide cueing to help the client learn to produce clearer speech. Frequent sessions are important for improving speech production. Other forms of communication, such as sign language, communication boards, or speech-generating devices, are helpful for many people. Everyone deserves the ability to communicate and connect with others. When a person has apraxia, speech therapy is vital in order to reach that goal.